Please note that the information within this video series on the Mental Health and Wellbeing Act 2022 is not legal advice. We'd also like to let you know that the content in these videos has been checked and approved by the Victorian Department of Health's Legislation and Entities Oversight Team. Hi, and welcome to the second video in Tandem's video series about Victoria's Mental Health and Wellbeing Act. This video provides an introduction to the Act's mental health and wellbeing principles, as well as an overview of the Mental Health and Wellbeing Commission. It's also about what the Act says about information sharing between mental health and wellbeing service providers and family, carers and supporters. I'd like to first mention that there are actually three sets of principles in the 2022 Act: the Mental Health and Wellbeing Principles, a set of principles about information sharing, and a set of principles about decision-making. The decision-making principles for treatment and interventions relate to compulsory assessment and treatment and restrictive interventions, which means seclusion and restraint. I'll talk more about the decision-making principles in video 3. So now we'll look at the mental health and wellbeing principles. These are very significant. The mental health and wellbeing principles are like a set of values for the Act and for the mental health and wellbeing system as a whole. They are intended to guide the way that services are delivered, indeed to fundamentally shape the way that services are delivered. The aim of the Act is to promote these principles being put into practice to help shape the experiences of consumers and their family, carers and supporters. The principles are described as being stronger and more comprehensive than those in the 2014 Act. They are designed to promote the rights of consumers, family, carers and supporters. We have here a list of the titles of the 13 mental health and wellbeing principles. I won't read through them all, as the rest of these videos provide more information about most of them. If you'd like to read the full text of each of these principles, we've included a link down the bottom of the slide there. A positive change in the 2022 Act is that mental health services and decision makers now have greater responsibility to uphold the Act's principles. Under the 2014 Act, a service was only obliged to have regard to the Act's principles. By comparison, under the 2022 Act, mental health and wellbeing service providers are required to make all reasonable efforts to comply with the mental health and wellbeing principles and to give proper consideration to these principles when making a decision under the Act. A mental health and wellbeing service provider that is required to prepare an annual report must include information about actions taken to give effect to one or more of the mental health and wellbeing principles. Formal complaints can be made if it is believed that a mental health and wellbeing service provider has not made all reasonable efforts to comply with the principle or other duty under the Act. And I'll explain the complaints process in video 3. Other entities and classes of persons established by the Act, such as the Mental Health Tribunal, the Mental Health and Wellbeing Commission, and non-legal mental health advocates, must give proper consideration to the mental health and wellbeing principles when performing a duty or function under the Act. Also, the Mental Health and Wellbeing Commission has a major role in promoting accountability throughout the mental health and wellbeing system. The Mental Health and Wellbeing Commission replaced the Mental Health Complaints Commissioner when the Act took effect in September 2023. As an independent authority, the role of the Commission is to monitor and publicly report on the performance, quality and safety of the mental health and wellbeing system and elevate leadership of people with lived experience. It should provide system leadership and hold government to account, including investigating complaints and conducting system-wide inquiries. Under the 2022 Act, the Commission has stronger oversight powers in relation to services and the system than the Mental Health Complaints Commissioner did. The aim is to have more transparency and accountability within the system, which is important in improving the quality and safety of services. The 2022 Act specifies that at least one of the commissioners must identify as having lived experience of mental illness or psychological distress, and one must identify as having lived experience as a carer or supporter. We have here on the slide a photo of the 4 commissioners. And at the very left is Jacqueline or Jackie Gibson, and she's in the designated carer lived experience role. In fact, all 4 of the commissioners have either lived experience of mental health challenges and or have family who have or do experience mental health challenges. When they started in their roles, the commissioners explained that their work will be a personal as well as a professional journey, and that they will be focused on the consumer and supporter experiences. They said, "We're not here to focus simply on a narrow set of data or government reporting." This reflects an overarching goal of the Commission, which is to lead transformative culture change in the mental health and wellbeing system. The Mental Health and Wellbeing Commission is an example of how the 2022 Act aims to embed the leadership of people with lived experience in Victoria's mental health system. This aim is reflected in the Act's lived experience principle. The lived experience principle is one of the Act's 13 mental health and wellbeing principles, and it says that the lived experience of a person with mental illness or psychological distress and their carers, families and supporters is to be recognised and valued as experience that makes them valuable leaders and active partners in the mental health and wellbeing system. I'd like to acknowledge that in order for this principle and all the other mental health and wellbeing principles to be lived out on the ground, we need real culture change throughout the system. The Act in and of itself will not be enough to achieve sustained change. It is lived and living experience-led reform that will change organisational cultures and the system overall. The Family and Carers Principle is one of the Act's 13 mental health and wellbeing principles. It states that families, carers and supporters, including children of a person receiving mental health and wellbeing services, are to be supported in their role in decisions about the person's assessment, treatment and recovery. I'll be going into more detail about what this can mean shortly. Other mental health and wellbeing principles that also specifically mention family, carers and supporters include the cultural safety principle and the wellbeing of dependence principle. The second part of the cultural safety principle acknowledges that appropriate ways for services to involve family can vary according to cultural background. It says that treatment and care is to be appropriate for and consistent with the cultural and spiritual beliefs and practices of a person living with mental illness or psychological distress. Regard is to be given to the views of the person's family, and to the extent that it is practical and appropriate to do so, the views of significant members of the person's community. Regard is to be given to Aboriginal and Torres Strait Islander people's unique culture and identity, including connections to family and kinship, community, country and waters. And the wellbeing of dependence principle reads, the needs, wellbeing and safety of children, young people and other dependents of people receiving mental health and wellbeing services are to be protected. As the Royal Commission into Victoria's mental health system acknowledged, the wellbeing and development of children and young carers can be profoundly affected by their experiences. However, they and their needs can be overlooked by services. As the Royal Commission noted, this can include difficulties being fully engaged in their childhood and education because of their caring role, and feeling excluded from services during a parent's hospital admission or discharge. The Wellbeing of Dependents principle therefore encourages services to consider the needs of any children or other dependents of consumers. One thing to note is that in practice, 2 or more of the 13 mental health and wellbeing principles might not always align with each other in some situations. As one example, at times, the views of some consumers might not always be the same as those of their family or friends when receiving mental health and wellbeing services. This might mean that the principle about the importance of consumers having autonomy is in tension with the family and carers principle. In cases such as these, attempting to find a reasonable balance between the principles requires the practitioners involved to have sufficient time and skill to really engage with the consumer and their family, carers and supporters, and to learn about their specific situation. It might also depend upon how the 2022 Act intersects with other legislation. Just one example is how the 2022 Act intersects with family violence legislation with respect to the safety of consumers as well as their family, carers and supporters. We're now going to look at the topic of information sharing, and in particular, what the Act says about information sharing between mental health and wellbeing service providers and family, carers and supporters. I'd first like to acknowledge that this is an important topic for many family carers and supporters and can involve difficult experiences, such as if important information that families need isn't communicated by a service. Under the 2022 Act, services have a responsibility to listen to family, carers and supporters where this is reasonable in the circumstances. For example, it might be considered unreasonable in some situations where a service has to make a decision urgently. You can request a family meeting with a service provider to talk about your perspectives. When you share information with a service, it will likely be documented in the clinical file of the person you support. People have the right to ask to read their clinical file, including to prepare for a mental health tribunal hearing. However, sometimes some of the information in a person's file can be withheld from them. If you have any questions or concerns about this, please contact the treating team or family carer peer worker or carer consultant at the service. I'll now talk about what the Act says about services sharing information with family, carers and supporters. The Act adopts a consent-driven approach to information sharing. This means that as a general rule, consumer consent is required for a service to share their health and personal information, and consumers can withdraw this consent at any time. This remains unchanged from the 2014 Act. As I mentioned earlier, when talking about the 2022 Act's mental health and wellbeing principles, the Act also aims to better involve family, carers and supporters and to assist them in their caring role. The Act includes a positive duty for service providers to share some or all of a person's health information to family, a carer or a supporter with consumer consent following the consumer's admission or discharge from an inpatient service. So this means if there's consent, services must share information with you at admission or discharge in line with the person's consent. This may include giving you information about the person's treatment so that you're informed and can participate in consultations about the person's care. However, disclosure is not required if it would pose a risk to the health or safety of any person, unreasonably impact on the privacy of other people, or is otherwise unlawful. If the person has not given consent or is unable to give consent, the Act says you can still be given information if it is general in nature to help you to provide care to the person. General information might include, for example, whether the person is being treated and is safe, general information about mental health conditions and helpful strategies. It might also include information about how to access supports, including for yourself, safety planning, and other information that can generally assist you as the carer to better support the person. If the person has not given consent or is unable to give consent and is also a compulsory patient, the Act says that you can be given health and personal information if that information is necessary for you to provide care to the person, including to prepare for your caring role. In these situations, the Act says that practitioners disclosing this information need to have regard to the consumer's views and preferences, including any expressed in an advance statement of preferences. It might be, for example, that the person wishes to keep some aspects of their health information private, and practitioners should take this into account. Also, if the person is placed in seclusion or bodily or chemical restraint is used, the Act states that a carer should be notified if the authorised psychiatrist is satisfied that the restrictive intervention will directly affect the carer and the care relationship. And what if a family member or friend isn't directly involved in providing care to the person? In these situations, the Act allows a service to disclose limited information in very general terms. For example, advising whether a person in hospital is well enough to receive visitors. It's important to note that the Act does allow the disclosure of information about a person's treatment, care and support to parents if that person is under the age of 16. There is, however, an important exception to all of this, and that is Section 31 of the Act. Section 31 states that if a person has a reasonable belief that by sharing the information, there is a risk that a person may be subject to family violence or other serious harm, then the information can't be disclosed, even if the person has consented to that information being shared. It is also important to note that a practitioner may share health information without consent where the disclosure is reasonably necessary to prevent or lessen a serious threat to a person's life, health, safety or welfare, or a serious threat to the public health, public safety or public welfare. This may apply where a family member or friend is at serious risk of violence or harm from the person they support. I'd like to provide more detail about information sharing when a person is receiving compulsory treatment. So in relation to information sharing, if some kind of compulsory order is in place, the Act requires a carer to be consulted or notified, as the case may be, if the carer and the care relationship would be directly affected by certain events. And we have examples of these events here. It's not a complete list, however, some of the events include when an assessment order is made, varied, extended, or revoked. The authorised psychiatrist must notify any carer if the authorised psychiatrist is satisfied that the carer and the care relationship will be directly affected. When an authorised psychiatrist is deciding whether to make or vary a temporary treatment order, the authorised psychiatrist must consult any carer and have regard to their views, to the extent reasonable in the circumstances, if the authorised psychiatrist is satisfied that the carer and the care relationship will be directly affected. When a temporary treatment order has been made, varied or revoked, the authorised psychiatrist must ensure that all reasonable steps are taken to notify any carer as soon as practicable if the authorised psychiatrist is satisfied that the carer and the care relationship will be directly affected. And I'll just mention here that a varied treatment order can mean that the treatment setting will change from an inpatient to a community setting or vice versa. It might also mean that a different mental health service will now be responsible for the person's treatment. Other examples of when the Act requires a carer to be consulted or notified, as the case may be, include When an authorised psychiatrist is deciding whether to apply to the Mental Health Tribunal for a treatment order, the authorised psychiatrist must consult any carer and have regard to their views to the extent reasonable in the circumstances, if the authorised psychiatrist is satisfied that the carer and the care relationship will be directly affected. When the Mental Health Tribunal schedules a hearing, it must give written notice of the date, time, place, and subject matter of the hearing as soon as practicable to any carer. When the Mental Health Tribunal is deciding whether to make, vary, or revoke a treatment order or to revoke a temporary treatment order, the tribunal must consult any carer and have regard to their views to the extent reasonable in the circumstances, if the tribunal is satisfied that the carer and the care relationship will be directly affected. When a treatment order has been made, varied, or revoked, as soon as practicable, an authorised psychiatrist must ensure all reasonable steps are taken to notify any carer if the authorised psychiatrist is satisfied that the carer and the care relationship will be directly affected. When a person on a treatment order does not have capacity to give informed consent to treatment proposed by an authorised psychiatrist, or does have capacity to give informed consent but does not give informed consent to treatment proposed by an authorised psychiatrist, in deciding whether there is no less restrictive way for the patient to be treated, the authorised psychiatrist must consult any carer and have regard to their views to the extent reasonable in the circumstances. When a restrictive intervention, seclusion, bodily restraint, or chemical restraint is used, as soon as practicable, an authorised psychiatrist must notify any carer if the authorised psychiatrist is satisfied that the restrictive intervention will directly affect the carer and the care relationship. If the consumer has consented and a service has an obligation to notify you of certain events, then copies of any compulsory orders or relevant statements of rights should also be given to you. Services are only obliged to notify or consult with family, carers and supporters to the extent that is reasonable in the circumstances. I'll also mention here that if a family member or friend is a nominated support person, there are additional events that they must be notified of or consulted about. And a person may also write in an advance statement of preferences that they would like one or more family members, carers or supporters to be kept informed. Information about nominated support persons and advance statement of preferences can be found in video 4. I'd also like to mention that Tandem has an information sheet on information sharing, which can be found on our webpage about the Act. And that brings us to the end of our second video. Up next is video 3, which is about the Act's decision-making principles, compulsory treatment, the ways that consumers' rights can be protected, and the health-led response. Thank you for watching.